Anxiety is a normal human emotion. Everyone experiences anxiety from time to time. It's that feeling of worry, nervousness, or unease we get when faced with a challenge, a stressful situation, or even an exciting event. Imagine the feeling you get before a big presentation, a job interview, or a first date. That's anxiety at work. These feelings are our body's natural response to stress. It's a way of preparing us to deal with potential threats. Think of it as our internal alarm system kicking in to keep us safe and alert. This system is crucial for survival, helping us react quickly in dangerous situations. However, anxiety is more than just a feeling. It also manifests physically. Our heart rate and breathing might increase, we might start to sweat, and our muscles might tense up. These physical symptoms are our body's way of getting ready for action, preparing us to fight or flee. While these sensations can be uncomfortable, they are not harmful. In fact, they can even be helpful in moderation. A little bit of anxiety can motivate us to perform better, focus our attention, and make us more alert. While occasional anxiety is normal for some people, anxiety becomes a constant and overwhelming presence in their lives. When anxiety is persistent, excessive, and starts to interfere with daily life, it may be a sign of an anxiety disorder. Anxiety disorders represent a group of mental health conditions where anxiety is the main symptom. These disorders are characterized by excessive and persistent worry, fear, and apprehension that is out of proportion to the actual situation. Unlike normal anxiety, which tends to be short-lived, anxiety disorders can last for months or even years. The intensity and persistence of these symptoms can significantly disrupt an individual's work, school, relationships, and overall quality of life. There are several different types of anxiety disorders, each with its unique set of symptoms. These include generalized anxiety disorder, characterized by chronic and excessive worry; panic disorder, marked by recurring panic attacks; and social anxiety disorder, involving intense fear of social situations. Distinguishing between normal anxiety and an anxiety disorder can be challenging, but there are some key differences. The main distinction lies in the intensity, duration, and impact of the anxiety. Normal anxiety is typically triggered by a specific event or stressor and subsides once the situation is resolved. For instance, feeling anxious before a presentation is normal, and the anxiety typically dissipates after the presentation is over. In contrast, anxiety disorders involve persistent and excessive anxiety that is out of proportion to the actual threat or situation. Individuals with anxiety disorders may worry excessively about everyday situations, even when there is little or no reason to worry. Another key difference is the impact on daily life. Normal anxiety typically doesn't interfere significantly with daily activities. While it might cause some temporary discomfort, it doesn't prevent individuals from going to work, school, or engaging in social activities. Anxiety disorders, however, can significantly disrupt an individual's life. The constant worry, fear, and apprehension can make it difficult to concentrate at work or school, maintain relationships, or enjoy hobbies and activities. Anxiety is a complex emotion, and its causes are multifaceted, often stemming from a combination of genetic, biological, environmental, and lifestyle factors. Understanding these factors can be helpful in managing and coping with anxiety. Genetic predisposition plays a role in anxiety disorders. Research suggests that individuals with a family history of anxiety disorders may be more vulnerable to developing these conditions themselves. This suggests that certain genes may increase susceptibility to anxiety. Our brain chemistry also plays a crucial role in anxiety. Imbalances in neurotransmitters, the chemical messengers in our brain, can contribute to the development of anxiety disorders. For example, low levels of serotonin and GABA, neurotransmitters that promote calmness and relaxation, have been linked to anxiety. Life experiences, particularly stressful or traumatic events, can also trigger anxiety and anxiety disorders. Exposure to trauma, such as physical or emotional abuse, violence, or accidents, can lead to the development of post-traumatic stress disorder, a type of anxiety disorder. Lifestyle factors such as diet, sleep, and exercise also influence our anxiety levels. A diet high in processed foods, caffeine, and alcohol can exacerbate anxiety symptoms. Similarly, chronic sleep deprivation and lack of physical activity can disrupt our body's natural stress response, making us more susceptible to anxiety. Section 5. Seeking help, the diagnosis of anxiety disorders. Recognizing the signs of an anxiety disorder is the first step towards seeking help and receiving an accurate diagnosis. If you find that anxiety is interfering with your daily life, it's important to consult with a healthcare professional. They can help determine if your symptoms are indicative of an anxiety disorder or another underlying condition. Diagnosing anxiety disorders typically involves a comprehensive evaluation that includes a physical examination, a review of your medical history, and a psychological assessment. The physical examination helps rule out any underlying medical conditions that might be contributing to your symptoms. During the review of your medical history, your doctor will ask about your current symptoms, their duration and severity, any previous mental health concerns, and your family's medical history. This information provides valuable insights into your overall health and potential risk factors for anxiety disorders. The psychological assessment involves a series of questions and questionnaires designed to evaluate your thoughts, feelings, and behaviors. Your doctor may ask about your worries, fears, and any avoidance behaviors you've developed to cope with anxiety. They may also use standardized questionnaires to assess the severity of your symptoms. Section 6. Navigating treatment. Finding what works for you. Treating anxiety and anxiety disorders is not a one-size-fits-all approach. The most effective treatment plan is often a tailored combination of therapies and, in some cases, medication. The goal is to help you regain control of your anxiety and improve your quality of life. One of the most common and effective forms of treatment for anxiety disorders is psychotherapy, particularly cognitive behavioral therapy, or CBT. CBT focuses on identifying and changing negative thought patterns and behaviors that contribute to anxiety. Through CBT, you learn coping mechanisms to manage anxiety-provoking situations and develop healthier thought patterns. Another effective therapy for anxiety is exposure therapy, often used in conjunction with CBT. Exposure therapy involves gradually exposing yourself to the situations or objects that trigger your anxiety in a safe and controlled environment. This gradual exposure helps you confront your fears, reduce your anxiety response, and regain a sense of control. In addition to therapy, medication can be a valuable tool in managing anxiety disorders. Antidepressants such as selective serotonin reuptake inhibitors, or SSRIs, and serotonin norepinephrine reuptake inhibitors, or SNRIs, are commonly prescribed to help regulate brain chemistry and alleviate anxiety symptoms. Section 7. Therapy for anxiety, talking your way to calm. Therapy provides a safe and supportive space to explore the root causes of your anxiety, develop coping mechanisms, and make positive changes in your life. It's a collaborative process where you work together with a mental health professional to understand your anxiety and develop personalized strategies for managing it effectively. Cognitive behavioral therapy, or CBT, is a highly effective form of therapy for anxiety disorders. CBT focuses on the connection between thoughts, feelings, and behaviors. It helps you identify and challenge negative thought patterns that contribute to your anxiety and replace them with more balanced and realistic thoughts. Exposure therapy, often used in conjunction with CBT, is particularly helpful for specific phobias and anxiety disorders like social anxiety disorder and panic disorder. It involves gradual and repeated exposure to the feared situation or object, allowing you to confront your fears, reduce your anxiety response, and regain a sense of control. Mindfulness-based therapies, such as mindfulness-based stress reduction, or MBSR, and mindfulness-based cognitive therapy, or MBCT, teach you to focus on the present moment without judgment. These therapies help you become more aware of your thoughts, feelings, and bodily sensations, allowing you to observe them without getting carried away by them. Section 8. Medication for anxiety, finding relief with prescriptions. Medication can be an effective tool in managing anxiety, especially when combined with therapy. Antidepressants, particularly selective serotonin reuptake inhibitors, or SSRIs, and serotonin norepinephrine reuptake inhibitors, or SNRIs, are commonly prescribed to treat anxiety disorders. These medications work by balancing brain chemicals that regulate mood and anxiety. SSRIs increase the levels of serotonin in the brain, a neurotransmitter that plays a crucial role in mood regulation, sleep, and anxiety. Commonly prescribed SSRIs for anxiety include sertraline, also known as Zoloft, escitalopram, also known as Lexapro, and fluoxetine, also known as Prozac. SNRIs work by increasing the levels of both serotonin and norepinephrine in the brain. Norepinephrine is a neurotransmitter involved in the body's stress response. Commonly prescribed SNRIs for anxiety include venlafaxine, also known as Effexor, and duloxetine, also known as Cymbalta. In some cases, your doctor may prescribe benzodiazepines for short-term relief of anxiety symptoms. Benzodiazepines are fast-acting anti-anxiety medications that work by slowing down the central nervous system. However, benzodiazepines are typically prescribed for short periods due to the potential for dependence and withdrawal symptoms. Section 9. A reminder. Your mental health matters. Remember, taking care of your mental health is just as important as taking care of your physical health. If you're struggling with anxiety, don't hesitate to reach out for help. Talking to a trusted friend or family member can be a good first step, but it's essential to seek professional guidance for diagnosis and treatment. It's important to note that the information provided in this essay is for informational purposes only and should not be considered medical advice. If you are experiencing symptoms of anxiety or an anxiety disorder, please consult with a qualified healthcare professional for personalized advice and treatment. Remember, you are not alone in this journey. With the right support and treatment, you can manage your anxiety and live a full and meaningful life. Take care of yourself, prioritize your mental health, and never hesitate to reach out for help when you need it.